I'm Troy Kirby with a quick look at the 2022 Washington State legislative session. The Senate Behavioral Health Subcommittee on Health and Long-Term Care held a public hearing on HB 1761, which would allow nurses to dispense opioid overdose reversal medication in the ER. The bill passed the House 94-0 and would have to pass the Senate in order to go to the governor's office for a chance to become law.
Beginning January 1st, 2022, hospitals are required to provide a person who presents to an emergency department with symptoms of opioid overdose, opioid use disorder, or other adverse event related to opioid use with opioid overdose reversal medication, unless the treating practitioner determines that an exception applies. Opioid overdose reversal medication is sometimes referred to as Narcan or naloxone, and it's a medication that can stop an overdose in progress, injectable medication. The hospital must provide directions for use and information about harm reduction strategies and services which may be available. And the bill in 2021 said that a practitioner in a hospital emergency department, which is defined as a person authorized to prescribe drugs, must dispense or distribute the opioid overdose reversal medication. What this bill does is it allows a registered nurse or licensed practical nurse to dispense or distribute the opioid overdose reversal medication instead of a practitioner in order to comply with the requirements within an emergency department.
The Secretary of Health has issued a standing order making opioid overdose reversal medication to any person at risk of experiencing an opioid-related overdose, or any person or entity in a position to assist a person at risk of experiencing an opioid-related overdose. Do non-medical professionals, if I'm recalling this, I feel like I worked with Representative Van Walkinshaw on this bill several years ago, or some version of this. Who is able to utilize Narcan or naloxone outside of a medical setting? Is it just made available to individuals upon request?
Yes, Senator, you're right. It was actually quite a few years ago that the DOH put in a standing order for distribution of Narcan or naloxone. So please, the thing I want you to keep in mind here is the emergency department is different. So it operates under a different set of laws. Like counsel said, we don't have oftentimes a pharmacy attached to it. 5195 from last year made a lot of changes to how the emergency department operates with regard to distributing Narcan. In this case, the bill revises an issue around that word practitioner, which under the law meant somebody who can prescribe and has the authority to dispense that scheduled substance. So in this case, allowing nurses in the ED to dispense Narcan makes an incredible amount of sense. Nurses are the ones typically on discharge.
So it is allowing them to distribute this medication. And we know how important this medication is for opioid overdose reversals. So giving it into the hands of the people who are going to be there with those patients as they come into the ER and be able to give it to them so that we can save their lives is critical.
Thank you for watching the 2022 Washington State legislative session.